Hi, my name is Hunter, and today I will be performing administration of oral medication. And getting started, I'm wearing my school badge, I'm wearing appropriate school scrubs, I've got my patient here, I've got my medication cups, and then my liquid medication as well. In addition to that, I also have my gloves here. Okay, I don't have any nail polish or no jewelry. So we'll go ahead and get started. In administering medications, we always want to verify the provider's orders first. After doing that, we want to go ahead and verify the 6 rights of medication. So right patient, right drug, right dose, right route, right time, and documentation. After doing that, we want to go ahead and check the MAR, and when we're doing this, we want to make sure that we're checking the label and the medication to the MAR 3 times. So 1 when we're taking it out of the drawer, 2 before we leave the medication station, and then 3 when we're at the patient's bedside. So in doing that, we then would move into dose calculations if they were necessary, and in this scenario, there are no drug calculations necessary. So we'll go ahead and talk about the medications and their dosage. So first off, we've got Doxycycline sodium, which is 100 milligrams. We've got warfarin, which is 5 milligrams. We've got furosemide, which is 20 milligrams. We've got potassium chloride, which is 20 milliequivalents. And then we've got liquid acetaminophen, which is 500 milligrams per 15 mLs. So after that, we would then, so that's our third check, we would then, or our second check, sorry, we would then move into the patient, go into the patient's room, and, oh, whoops, not mean to do that. We would then set our medications down on a clean, flat, dry surface. We would, again, knock on the patient's door, enter the patient's room, set these down, close the door behind us to ensure patient privacy, introduce ourselves to the patient, and when we're doing this, performing our hand hygiene. Hi, Mr. Smith, my name is Hunter. I will be your nurse today. Can you go ahead and verify your first and last name and your date of birth? And in doing this, we would verify the patient's armband. Okay, the patient has been identified. After that, we would want to ask the patient if they have any allergies. Mr. Smith, do you have any allergies? No? Okay, great. So from here, we would want to go into, again, performing our hand hygiene and then putting our gloves on, because we're going to move into the administration process here. And then here we would want to do our third check of the medications. Again, this is where we would do our third MAR check of the medications, again, to make sure that we're administering the proper medication. And we would check the labels as well. And then from here, we want to move into the pre-assessment, and that is going to look a little different for each medication. But with a pre-assessment, we always want to assess, or we always want to remember that we need to take baselines before we administer medication. So whether that be blood pressure or pulse, labs, etc. So we will go ahead and move into talking about the medications a little bit. So with the Doxycycline, with the Doxycycline sodium, we want to make sure that the patient is not experiencing any vomiting or diarrhea. With the warfarin, we want to make sure that the patient is not experiencing any experiencing any bleeding. Sorry, we want to make sure they're not experiencing any bleeding, or any irregular lab values that may indicate that. So like the INR or PTT. And then the furosemide, we want to make sure that the patient, or make sure that we take the pulse and the blood pressure and the pulse prior to that. And then again with the potassium chloride, we want to take blood pressure, pulse, and then potentially an EKG, just depending on what the situation is, as that can have an effect on electrolytes. And then with the acetaminophen, we want to make sure that the patient does not have any liver complications, any elevated enzymes that may indicate a contraindication of administering the acetaminophen. So then after kind of discussing that pre-assessment check before we administer, we would then kind of move into our actions, uses, side effects, and then adverse effects. So we would speak with the patient about each medication. All right, Mr. Smith. So for the Doxycyt, we're going to talk about what they're used for, and then any common side effects and or adverse side effects. Now, if you have any adverse side effects of these medications, these are effects that we don't want to happen. And so if they are to happen, you please let us know immediately, okay? And we'll go ahead and notify the healthcare provider. Okay, so we would then talk about the medications a little bit. So moving into the Doxycyt sodium, so this is going to be a stool softener. And common side effects might be a little bit of abdominal cramping or nausea. Any adverse side effects is going to be facial swelling or a rash, okay? The warfarin is going to be, or it's an anticoagulant, and this is going to help with any blood clots, okay? So for this, if you have like a scratch or a scrape, you might notice that you bleed a little bit more, or you have a little bit harder time healing. And one thing to be mindful of is as you brush your teeth, you might experience a little bit of gum bleeding. But if, in that case, it might be best to use a soft toothbrush and just, be a little bit self-aware of that part, okay? Adverse effects might be coughing up blood, blood or stool, or blood in the stool or urine. So, make sure you keep that in mind. And then moving into the furosemide, this is going to be a diuretic. It's going to help with that excretion. And you might experience some common side effects. You might experience some increased thirst, maybe a slight headache, any adverse effects that you might experience. Again, these are things that we don't want to happen. So if they are to happen, please let us know immediately. So muscle cramping or any type of weakness. And this is the one that can have an impact on the fluid and electrolyte balance, okay? So again, if you experience any of the adverse effects, please let us know, okay? Moving into the potassium chloride. So this is going to help with those potassium levels. Make sure that we are in range and in a healthy potassium level. Make sure it's not dropping below that optimal range, okay? So for this common side effect, you might experience some gas, maybe a little bit of an upset stomach. As far as the adverse, any type of weakness or, heart palpitations. And again, just let us know if you experience any of those, okay? And then moving into the liquid acetaminophen. For this one, this is going to be an antipyretic analgesia, and it's going to help with any pain relief. And common side effects might be nausea or a suppressed appetite. You might not be as hungry. Any adverse effects might be a rash all over or any kind of abdominal pain, okay? Do you have any questions? No? Okay, so we'll go ahead and set the patient up if they are lied back, but we want them to be sitting up in a comfortable position as long as it's not contraindicating. All right, Mr. Smith, are you able to take these medications all together, or do you like to take them separately? Okay. All right, you can take them all together. Okay, great. So we'll go ahead and, again, empty them into the cup. Okay. And then we would put these in the appropriate disposal, you know, obviously trash and whatnot. Okay. All right, so again, the patient is sitting up. We will go ahead and give the patient their medications as long as they don't have any other questions. Okay, there they go. And then, you know, they take them, offer them their water. Okay, great. All right, did that go down okay? Yes, okay, great. Now we're gonna go ahead and administer the liquid medication. And with this one, we wanna make sure that we mix it up really well. And when we are measuring this out, we want to make sure that we're doing it on a flat surface. And again, when we're doing the liquid medication, we want to make sure that we are putting the label in our hand to avoid any damage to the label. Okay. And when we are removing the cap, we want to make sure that we put it straight up on the counter here to avoid any type of contamination. Okay. Find the 15 mLs, right? And then we're gonna go ahead and then when we are pouring this, we want to make sure that we're not touching any of the rim to the cup or doing any kind of cross contamination. Okay. Okay. And then again, putting the cap back on with no contamination. Okay. All right. Now we're going to show the camera our 15 mLs. Can you see it? Kind of wonky, but right. So we're going to go ahead and give the patient the medication. Okay. Right. And then wash it down with water. Okay. Great. All right. How's that feel? Everything okay? Okay, great. So then from here, we would go ahead and we would sit the patient back up. We would make sure that the patient was aware of, you know, their call light, giving them their call light, make sure that they are educated and know how to call if they need assistance. We would, you know, again, lower the bed if necessary or raise arm rails if that was necessary in the situation. So then we would take the medication with us. We would remove our gloves, perform our hand hygiene, and again, take our medication. We would exit the room and then document the procedure.